Assalamualaikum and hello. My name is Amalin Mirsya Binti Syahrul Izwan and my metric number is BM23110010. So today I'm going to talk about female reproductive system. The human reproductive system is a complex network of organs and structures responsible for producing, transporting, and nurturing gametes, which is sperm and egg cells, to facilitate fertilization and the development of a new individual. So the key components include the male and female reproductive systems. The female reproductive systems involves ovaries, which is produce eggs and structures like the fallopian tubes and uterus. The uterus support embryo development, and the cervix connects it to the vagina. The vagina serves as a passageway for sperm, and it was the birth canal during childbirth. Menstruation, ovulation, and menstrual cycle are integral aspects for female reproductive system, and it was regulated by hormone like estrogen and progesterone. So the coordination between the two systems is essential for successful reproduction. So my interest in medical specialty is gynecology. So who is gynecologist? A gynecologist is a medical doctor who specializes in the health of the female reproductive system. They provide care for women throughout various life stages, addressing issues such as reproductive health, pregnancy, childbirth, and also menopause. So gynecologists also diagnose and treat conditions related to the uterus, ovaries, fallopian tubes, and also breasts. Regular visits to a gynecologist are important for women's overall health and well-being. So there are two famous gynecologists in Malaysia that inspired me a lot, which are Dr. Siti Zaliha Zainal and also Dr. Nur Hazinat Muhammad Yunus. So now I'm going to talk about the internal parts of female reproductive organs. So let's look at the cervix. Cervix is the lower part of the uterus, and it connecting it to the vagina. So what is the function of cervix? Cervix acts as a gateway between the uterus and the vagina, it playing a crucial role in childbirth. The cervix is also produce mucus that changes in consistency during the menstrual cycle to facilitate or inhibit sperm movement. And the next one is vagina. So vagina is a muscular canals that join with the cervix. It was lined with the mucous membranes to keep it moist, and the function of it is accommodating a baby during delivery and serves as a passageway for menstrual blood, and also receive the penis during sexual intercourse. And the next one is oviducts, if you can see. Oviducts or fallopian tubes, which are two tubes connecting each ovary to the uterus. So oviducts serve as a pathway from the egg to travel from the ovary to the uterus. And fertilization of an egg by sperm typically occurs in the oviduct. And the next one is uterus. Uterus is a muscular organ located in the pelvic cavity, and thus it is hollow and pear-shaped organ. Uterus provides a site of implantation and development for a fertilized egg during pregnancy. If no pregnancy occurs, then uterus sheds and its lining during menstruation. And the next one is ovary. Ovary is a pair organs on each side of the uterus, thus it is small and oval-shaped glands. Ovaries produce eggs and hormones, including estrogen and progesterone. These hormones regulate the menstrual cycle and support pregnancy, and also influence various aspects of women's reproductive health. So these organs work together in a coordinated manner to support the processes of the menstruation, ovulation, fertilization, and pregnancy in the female reproductive system. So these are the common diseases related to female reproductive organs. So let's look at the first one, which is endometriosis. Is a medical condition where tissue similar to the lining of the uterus called the endometrium, well, it grows outside the uterus. These tissues can be found on the ovaries, fallopian tube, and also pelvic structures. During the menstrual cycle, this tissue behaves similarly to the normal endometrium, thickening, breaking down, and bleeding. However, unlike the normal endometrium, the blood and tissue shed in these areas have no way to exit the body, leading to inflammation, pain, and formation of scar tissue. So, the common symptoms for endometriosis include pelvic pain, especially during menstruation, pain during intercourse, and also fertility issues. Diagnosis often involves medical history, physical examination, and sometimes imaging studies or laparoscopy. The treatment options may include pain management, hormonal therapies to regulate the menstrual cycle, and also surgery to remove the endometrial implants and scar tissue. Endometriosis can be a chronic condition, and management approaches depend on the severity of symptoms and the individual's reproductive goals. The next one is uterine fibroids. Uterine fibroids are non-cancerous growths at the uterus that often appear during childbearing years. So these tumors can vary in size, number, and also location within the uterus. While many women with fibroids may not experience any symptoms, others may have significant discomfort and complications. So the common aspects of uterine fibroids include the symptoms are depending on their size and location. Fibroids can cause symptoms such as heavy menstrual bleeding, pelvic pain or pressure, frequent urination, and also backache. The treatment options vary based on the severity of symptoms, the size and location of fibroids, and the individual's reproductive plans. So options include medication such as hormone therapy to regulate menstrual cycles or reduce bleeding, and surgical interventions like myomectomy, which is removing the fibroids, or hysterectomy, which is removing the uterus. And it's very important to know that fibroids are common and not all fibroids require treatment. Regular monitoring and consultation with a healthcare provider are crucial to determining the appropriate course of action based on individuals' specific situations and symptoms. So this is the last part of presentation, and please take note. The tips for having a good reproductive care is, first, you have to quit smoking, have a healthy diet to control your weight, don't use scrub on your intimate area, wear a comfortable underwear, take bath regularly, and also change your tampons or pads frequently during period. That's all from me. Thank you.